Hey guys, the Brat is hospitalized in a Atlanta hospital for high-risk pregnancy. Let's talk about it. Hit the like button as you come onto the page. I appreciate it. Thank you. So the Brat was put on bed rest by her doctors. She is due in a little over a month, but her doctors fear that because of her age and where the baby is located, she may give birth any day. So, in order to keep the baby in as long as possible, doctors have admitted the Brat into an Atlanta hospital and have placed her on bed rest. Typically, pregnancy care providers will recommend bed rest if it means they're concerned about the health condition that can cause pregnancy complications or premature labor. Healthcare providers sometimes will prescribe bed rest during pregnancy to increase the chances of your pregnancy being carried to full term. So the Brat is being put on bed rest, which means that most of the day she's in the bed. In some cases, she may even use a bedpan and not even go to the toilet. Not leaving the bed sometimes is necessary, especially when they're spotting. But we see the Brat in a video dancing around, so obviously she can get out of bed. So I wanted to know a little more about when women go on bed rest, some of the complications. So I pulled it up on the Mayo Clinic, and it says the length of time that a woman is on bed rest all depends on the condition, and we already know that Brad's condition is because of her age and the position of the fetus. That's why her doctor put her on bed rest. And the doctor did that to prevent preterm labor or premature birth. We don't know how long the Brat is going to be on bed rest, but it varies depending on the woman and the condition and what's going on. It may be for a few weeks, a few months, or for the rest of the pregnancy, the duration. So carrying your baby to term means you are pregnant at least 37 weeks before your baby is born. Your doctor can recommend you going to the hospital like the Brat, or recommend that you stay in bed at home so you're on restricted activities to ensure that you don't go into preterm labor. And many health care providers see the benefit of bed rest. They believe it leads to a more successful outcome. There are several types of bed rest. There's strict and complete bed rest, which involves staying in the bed most of the day, which reduces your chances of walking too much or standing too much. That is the goal, for you to hold the fetus in longer. And then there is modified bed rest, which means you can sit or stand and take short walks a few times a day. You can even do light housework. Another reason for your doctor to prescribe bed rest is if you have preeclampsia. Preeclampsia is essentially a dangerous condition that includes swelling, increased blood pressure, and protein in the urine. Another reason for bed rest can include vaginal bleeding, bleeding due to placenta preview. The placenta covers part or all of your cervix, which means the placenta can detach from your urinary wall prematurely, causing danger to the fetus. Another reason for bed rest is premature labor, labor that begins before the 37th week of pregnancy. Another reason, again, for bed rest can be cervical effacement, thinning of your cervix. And definitely, if you're carrying 2 or more fetuses, your doctor may want to put you on bed rest. And some doctors like to put their patients on bed rest if they've had previous pregnancy complications, such as fetal loss, stillbirth, or premature births. Then there's a condition known as intrauterine growth restriction, which means the fetus measures very small for its age. Now, that condition may mean the doctor putting you on bed rest. So we're hoping the best and wishing the best for the Brat, hoping that her pregnancy is full term. Don't forget to like, share, and subscribe to my channel. I will see you all on the next video. Thanks for watching.